everyone. My name is Ginika Ibezim, and my co-presenters are Nila Jones and Manuela Garcia. Today, we will be presenting our QI project entitled Retention Among Underrepresented Minority Students in the Medical Field, a comparison between longitudinal and singular intervention. In 2018, UMKC's Diversity Office recognized the necessary intervention after data showed a 70% graduation rate of the 83 URM students from the 5 graduating classes from 2008 to 2012. Looking through current literature, we noticed a lack of proven strategies to increase retention of URM medical students. To address this disparity, we applied and received a federal grant from the U.S. Health Resources and Services Administration. From that, we developed a mentoring program called STAR, Students in Training in Academia, Health, and Research. We also partner with local area medical schools to hold an annual event that supports URM medical student success. This study functions to distinguish the impact of a longitudinal program versus singular intervention contributing to URM retention and graduation.
Description: a 6-point Likert scale survey was given to UMKC students prior to and 6 months into the STAR program to understand prevalence of factors affecting retention. The survey was also administered before and after a 2-day annual event to local non-STAR medical students. T-tests and parent t-tests were used for analysis. We compared the STAR pre-survey to the STAR mid survey and the annual event pre-survey, as well as the STAR mid survey to the annual event post-survey. Please note, values approaching significance were also included. Outcomes: STAR pre-survey versus STAR mid-survey data suggests less student enjoyment as they progress. However, the degree of satisfaction with the welcoming atmosphere of the program and the diversity of faculty and staff increased. Students also showed increased confidence in their ability to understand and apply medical topics. STAR pre-survey versus annual event pre-survey data suggests STAR students were more satisfied with the welcoming atmosphere of their program and the diversity of faculty and staff. STAR students also had higher average confidence levels in their ability to understand and apply medical topics. STAR mid-survey versus annual event post-survey data suggests STAR students were more inclined to stay in the medical field, had more enjoyment on their campus, and knowledge of the skills needed to succeed. The means also suggest STAR students have stronger beliefs, the diversity will provide better services to diverse patient populations, and that a career in medicine is worth the time and effort. Our data suggests that both longitudinal programs and singular events encourage morale in students. However, the higher means in the mid-STAR survey compared to the post-annual event survey suggests that a longitudinal program like STAR may be a better approach to improving retention and graduation rates among underrepresented minority students.
Discussion. Current research echoes the disparity we found at our medical school and discusses the necessity for intervention. However, the calls to action are more numerous than there are clearly proven interventions. The novelty of our research is that we not only accounted for a disparity in the retention and graduation rate of our URM medical students, but also developed an intervention that could be analyzed and replicated. Our data suggests that URM retention in medicine may be impacted by addressing identity development, sense of belonging, imposter syndrome, confidence in academic success, and commitment to medicine through facilitated mentorship. Limitations of our project include the context of each intervention's data collection and decreased response rates to surveys administered. STAR data was collected during the 2019 to 2020 academic year when events were initially conducted in person and transitioned to virtual. The annual event was conducted virtually during the COVID-19 pandemic in fall of 2020. This permitted technological difficulties, modifications to breakout sessions, and networking. Our study included a relatively small sample size due to the nature of the student demographic and low response rates in subsequent surveys. Our study was limited to 3 local schools in the Kansas City area. Extrapolation to other institutions would require additional supportive research. Conclusions. Our study suggests that through the STAR mentorship program, students have shown increased confidence in their medical application and understanding. When comparing longitudinal versus singular intervention, students had an increasingly positive determination to graduate, knowledge of the skills to succeed, perception of the diversity in the medical field, and greater appreciation for how diversity in medicine is advantageous to diverse patient populations. Although both longitudinal and singular intervention are beneficial to the morale of our students, longitudinal mentorship programs may have proven to have a greater impact on the retention and the development of URM students. The success of STAR may have university-wide implications as well as directly affecting the diversity of hospital staff and medical school faculty. Further research is required to determine long-term implications for the STAR program and benefit of implementation at other institutions.